What's up, folks? This is Eric, the Not a Real Doc DPT, and um, welcome back to the channel. Today, what we're going to be continuing is the last of the videos I've been doing on what should you expect on your first evaluation in a series of different settings. And so today we'll be talking about the last setting that I'm doing this for, or doing these topics on, which is going to be in a skilled nursing setting or in a rehab, an inpatient rehab type of setting. Similar to the other settings that you'll see a physical therapist within, on that very first evaluation, the PT will have already gotten to see your health history and all of your information that's been sent over, generally from the hospital. Will usually be, well, let me step back. So usually when a patient is admitted into the skilled nursing facility, oftentimes it'll be in the morning, not always, but oftentimes they're coming in from the hospital. They've discharged sometime early in the morning and then are generally transported over. So our visits are generally going to be made in the afternoon to do these evaluations. And oftentimes, the nursing has already come in and started looking at this patient and looked at all their medical or the medical side of things with them and seeing what they're going to be doing to help take care of this patient. So then PT will then be following up with that. Usually our visits are about 30, maybe 45 minutes, something like that. Maybe not quite 45 minutes. And the well, I should qualify that. There are certain amounts of times. There's a certain amount of time that we're supposed to spend with a patient within a skilled nursing facility. So we'll be doing the full amount of time or we'll be spending the full amount of time that Medicare requires us to stay with you during that evaluation. But you'll be active and doing stuff for probably about 30 to 45 minutes of that, I should say. So let me qualify kind of what I'm saying. But during that evaluation, when we first come in to the room, again, we'll introduce ourselves and we'll then be talking with you about trying to get an idea of who you are as a person, what type of house are you going to be returning to? Does that house have stairs? Do you have caregivers there? Do you not have caregivers there? You know, what, how active are you as a person? What is it? What is everything? We're trying to get a picture in our heads at that point of what is it going to be required of us to do to help you to return home safely. That is usually the goal of the physical therapists that are within these skilled nursing settings. Um, and we see a variety of patient types in that setting. Most often, those are going to be maybe stroke type patients or patients that have some sort of new nervous system conditions, whether that, as I said, whether that's a stroke, whether that's, say, like a Parkinson's diagnosis, whether that's, um, nerve, uh, like nerve injuries themselves. Although those types of patients usually will go to a specific type of rehab facility that is designed to care for um, like nerve damaged patients. So like if you have, like, say, paraplegia or quadriplegia, those are not generally going to your typical um, nursing facility. I need to qualify that also a little bit. That you might have some patients that would go there just because they couldn't have a bed in other places, but usually those types of patients are going to a very specific um, neuro type of care facility. And I am not including them into this series of discussion points for these evaluations because I've never worked at a facility like that. Um, the I've during my doctorate program, I did some work with that a similar type of facility, and we did some of our study lessons, or some of our labs at a facility that was near our uh, university setting on those types of patients. But it's not something I have a lot of experience in, so I can't say. I really don't feel comfortable including them in and those types of patients in this discussion point. So if that is you as a patient, then I would say you are going to need to look somewhere else for more information um, regarding how those evaluations are going to go. So what I'm talking about more specifically are going to be the rehab facilities that are found around most towns. These are skilled nursing facilities where that are going to see more generalized types of patients. All right. So anyway, uh, so on that first evaluation, as I mentioned, we'll be talking with you about what your goals are and trying to see what we can do to help you to get or to return to um, your home. And during that first eval, then we'll start looking at your strength. So again, we will similar to in the hospital setting. If you listen to that video that was done, we'll have you sit at the edge of bed. Then in that time, we'll be able to assess, your trunk control, seeing what type of balance and stability you have. We'll be looking at your strength of your legs, strength of your upper body, how well you're able to control things. We usually will do some neuro tests at that point, because a lot of patients that we have, as I mentioned, may have had CVAs, may have had Parkinson's, may recent diagnoses, and so we're still trying to assess and see what type of um, uh, patient type you may be falling under there. And then during that very first evaluation, we will try to get you up. That also one patient type that you see often in skilled nursing facilities would be, say, like a recent amputee type of patient. And so these are the patients that we do need to help them learn how to appropriately transfer and things. And so those that's another patient type that's pretty specific, but that we would see at a skilled nursing facility. But anyway, um, and so so in that first eval, after we've looked at your strength and done maybe a few nerve tests, we will have you stand. We'll do a couple of tests with you in standing, again trying to assess your balance and how well you're able to move around, and then we'll see how well you're able to walk. A lot of times that might require us bringing in other types of things to help with that. Like sometimes, say you're a recent stroke patient, and those types of patients need some additional equipment to help them stand. So in a skilled nursing facility, we usually have access to those types of things that will be able to help us to get you upright. Because one of the most important things to do is to weight bear once you've had a stroke, is to try to weight bear through through those affected joints, because once you have that sensory input coming in from the floor, say, then it helps to try to reactivate those nerves, try to reactivate those areas of the brain, not reactivate, rewire, I should say. So your brain is plastic, meaning that the brain will repair itself. And so with strokes, we are trying to send that sensory input back up through the nerves that were impaired, or through the muscles or the side of the body that was impaired. So that way that sensory information is coming up to the brain, and then the brain is having to say, hey, where is this coming from? And it will rewire itself to connect with the sensory input that's coming up through those impaired nerves. I hope I haven't confused you. That's not really the intent of this video to get into all that. So, but anyway, so that's one of the reasons that would be doing some early ambulation with you if you've had a stroke. And so if you are questioning why we would be using a stander to be able to do that, but that's the reason why. So that evaluation, during that point, we are trying to assess how well you will be able to participate with us. Usually, in a skilled nursing facility, you are wanting or we're needing you to do about 3 hours of work a day. That's going to be 3 hours composed of physical therapy, possibly occupational therapy, or typically occupational therapy, actually, and then possibly speech therapy. So usually through all those three therapy or three different types of therapies, we will want you to get 3 hours worth of care throughout the day. So um, we're during that first evaluation, we're trying to find out, okay, how well will you be able to tolerate that? Where does that work need to be done? For the most part, we are trying to get you into the gym and getting you out of the bed, out of your room, so that you can get into a gym setting. Usually, patients really like that a lot because there is a lot of interaction that happens there. There's a lot of discussions. A lot of times, it's fun. Patients usually will have fun in the gym, kind of joking around with each other, joking around with the PTs or the OTs or the therapy staff that's working there. And so there's a communal environment that happens in the physical therapy gym setting at a skilled nursing facility that can be really, really beneficial to a patient and can assist with their care. Also, down in the gym, there usually are parallel bars. So, say you've had a recent knee replacement. Well, we can get you up safely in those, and maybe you've had some trouble standing at a walker or something because of your stability. Well, knowing that I have a set of parallel bars in the PT gym, then that's is something that's going to help me to get you to be able to stand, to be able to provide again that early weight bearing, early ambulation, early mobility that will help your body to accept the joint that or the new joint that you have. So, um, all during that first eval, we're trying to assess, how well are you going to be able to participate with us? Where will most of your work need to be done? Occasionally, you will have those patients that you can't get out of their room, and that you'll have to do see them just in their room, and you can't get them into when you can't get them into the gym. Sometimes that may happen. Like we've had patients who have say C. diff, and all of a sudden those patients they prefer them not to leave their room. They prefer them to stay in their room. So that means all of their therapy sessions will be done in their room. We generally, sometimes it might even be in their bed. And yes, I've done 45-minute sessions in a for physical therapy, all within a patient's bed. Uh, it's excuse me. It's not my favorite thing to do by any stretch of the means, but and it's usually not the patient's favorite thing to do because they're not always feeling really great. But when you're in a rehab facility, it is one of the understandings that you are going to be active and are going to be doing about 3 hours of work per day. If you are not able to do that, then that uh, might necessitate that patient is no longer fit for the skilled nursing setting. And um, so that's why we will do everything we can to make sure that we can get in the amount of therapy that you need to progress and get improving in your situation. Yes, even if that means that you have C. diff or an upset stomach or something like that, and you're confined to your room and we're having to do all of your work within your room. So, yes, we will do that to make that happen. Um, the uh, as I said, the ultimate goal of skilled nursing is to have you safely transition home. Usually, patients are there for a week, maybe 2 weeks, and so in the skilled nursing setting, we generally will have a better idea of being able to see you and progress you. We will generally start off having you, maybe giving you actually a home exercise, so to speak. So, asking you, say, hey, later in the afternoon, maybe do this and this exercise, especially if it's for a knee replacement or something. Um, We may see you multiple times a day. That sometimes happens. If it's just maybe with PT, if we come in the morning and patients may be in the bathroom, or they may just not have woken up yet or something. We may come back and see them later, or we may try to say, okay, hey, can I see you now for about 30 minutes, and then I'll come back later in the afternoon for about 30 minutes. That is one thing about skilled nursing, is that your patients are always there. And so there's very little reason for patients not to be seen. It's expected, and that patients will be working with you when you are in those types of settings. So, but as PTs, we, during that very first evaluation, are trying to set you up for the best success, so that we can get you home as quickly as possible, and get things moving in that direction for you. So I think that's about it for the skilled nursing setting. I hope that if you are a patient who is in this setting, I hope that this video has given you a little bit of information as far as what you can expect as from your physical therapy evaluations, and especially that very first evaluation when you come in to see us. And as I say, we'll be saying prayers for you, that your healthcare will progress in a positive direction, and hope that you can get home soon. All right, you tune into our this channel for future videos on physical therapy, and hope that you have a good one. All right, thanks so much. Bye.